And take it off, and then he's gonna put it back on.
Oh.
We're gonna need to keep it on. Just need clean bandages and all that.
Mm-hmm.
Oh man.
Well, you gotta keep it clean.
Yeah.
If you don't keep it clean, then it gets infected, and then you're just
Yeah, but right now it's just like it's suffocating. Okay. I just want to.
Suffocating because it's 100% freaking humidity out all the dang time right now.
Mm-hmm.
Oh man, I'm
That
scared.
cotton's gonna absorb that like nothing. You don't need to be scared.
I'm scared to see what it looks like.
Well, your toes are actually kind of yellowish up there.
I think that's normal.
Mm-hmm.
Yeah.
What's the betadine?
Yeah. Oh, I mistook it for like blood on her big toe earlier, like dried blood or something.
I wouldn't be surprised.
Yeah. Like I said, with where all your cuts are, like if you're gonna bleed, it more than likely come out through the bandages and up through.
You alright?
Yeah. That just
It's gonna stuck to the blood.
was a little weird. Oh my god. When did that come around me?
Huh?
Did he put that or did the hospital put
No,
that?
that's what the hospital put on you. Yeah, whenever you went in there and they checked you out. And,
Oh.
yeah, and they put that on.
Wow, those pills got me all messed up.
So, when you went to the hospital, they redid your dressing?
Yeah.
That's
Hey,
not
real
good.
quick, can I borrow you?
No.
Yeah.
They call your, who's your primary, Sharba? No.
No,
No,
it's
The one in Blair's.
You alright?
Yeah. Shoe heart.
yeah,
Okay.
shoe
That's
heart.
Did they call your primary?
No.
No.
I don't believe, I'm gonna look through my phone right now to make sure. But nobody ever called me. Did they do x-rays or anything there?
No.
No. Yeah. That's gonna hurt.
Yeah, we'll make it wet so it comes off.
Yeah.
You're gonna pull up your ER chart.
I got hurt enough whenever I had like bandages sticking to my burn on my arm here. I tried to take it off just because I woke up the next day where I'm just trying to keep it covered and the scab would stick to that and that hurt. I don't even want to know what that's going to feel like. Then again, I didn't wet anything. I just pulled it off.
So it was Saturday, right?
Yeah.
Yeah.
Sometime in the
Is
morning.
it hurting you?
A little
Yeah,
bit.
they never called me.
Yeah.
Did they tell you they called me?
Not that I remember.
I
But you
think she
told them I
said
was a
something
surgeon,
about.
right?
Yeah. Like, I'm pretty sure she said she'd make sure to let you know.
Yeah, nobody let me know.
Yeah. It sounds like Indiana.
You alright?
Yeah.
It's gonna tug a little there. Definitely needs clean.
This like it's not even doing nothing there.
Yeah.
Is it cold?
Yeah.
Sorry.
But it kind of feels good at the same time.
That's not my phone.
What's going on? So the patient that I operated on Thursday, 3.5-hour surgery, got nauseous and went to the ER on Saturday. The patient told
can't-
them
it's
that
like so-
I was the surgeon.
Yeah, it's
who
just so
operated on the right
saturated.
shoulder.
Going into it.
They said, you know,
I'm
"There we
trying.
No,
go."
you're fine. You're
Yeah,
fine. It's
yeah.
just I don't want to pull it. So if it doesn't come there, it's coming. So there we go. I don't want to like tug because I know it has to be painful. And like I saturated it obviously. You see all the water,
Oh, yeah, it's
and it ain't doing nothing.
No.
I don't have any phone calls from the hospital.
And basically your scab grew into the
Basically.
bandage and like pretty much the bandage is now like grown into your foot in a way. But more around the stitches, which is definitely a problem because they tug that a little too hard and take your stitches out and you're going to be bleeding all over the place.
Am I bleeding?
A little bit up top there, yeah.
Yeah, that's okay. That's not.
It's not too, it's nothing to really worry about there.
That might explain why I've been feeling like suffocating on that side.
Or maybe even the burning sensation in your foot that keeps going up and down your leg at night too.
You alright?
Yeah,
That didn't even start until when? Sunday?
I don't know.
Sunday or Monday, something
Somewhere in
like that.
there.
You alright?
Yeah.
You're not gonna pass out?
No.
Wait, what's going on?
Let me grab some more.
Well, because that's not what they didn't put the dressing on that I typically do. Right. I'm just trying to see.
Still
if you
hurt though.
saw
I don't know why.
I can't imagine why your foot swelling up to twice its normal size would hurt.
No, this side when she was pulling it, like what? Oh, maybe that part
Because
right
of the
there.
stitches, yeah.
Sorry.
Yeah.
I tried to be gentle. I doused lots on it.
Yeah, I know.
I soaked it.
So it was Cheryl, Dr. Pratsky? Is that who you saw?
Rasky?
I don't know.
That's who signed your ER note.
Oh, okay. Well, that was the last person who discharged.
I just know it was an older woman, definitely a doctor, not
Don't
just a
do this.
nurse.
Okay.
Trish, be careful.
I am. I'm too short. All right.
Ugh.
Oh,
What is your pain level?
right now?
Well, before I just
Well, yeah.
hurt you.
Before there was like no pain, just discomfort,
Okay.
Yeah. Well, that's good.
and now,
Might be bad.
Well-
With the nausea medicine, you're doing fine. Then you're tolerating your pain meds.
well, the pain medicine they put them on, which I forgot to freaking bring to get refilled.
Oh, don't worry.
Well, I did not take my nausea pills, and I'm feeling a little nauseous.
It's not like there still ain't oxycodone left.
I'm done with that.
Oh yeah, what are you on now?
Zofran.
Zofran?
Isofren, yeah.
Okay, you can
I'm gonna grab some Ace.
I can quit filming now.
stop for now.
Stop for now.
Just a little bit.
Where's it hurting?
Right
Where
down
do I
here.
do? Okay.
Yeah.
Ah,
Oh yeah.
Do they do x-rays?
no.
Yeah, that's gonna be tender right now.
Did you fall?
No.
You're definitely swollen in this area, and that's why we wrap you in that the big dressing I had you in. They obviously didn't put you in that big
Yeah.
dressing, right?
Yeah. Like they
Um,
basically took off like half the bandages you had wrapped up around it. And
Yeah, they should never have done that because
Yeah.
now we got a lot of swelling. But we'll get it away. We'll get it down, okay?
Okay.
Let me get all this out of here. Trish, can you grab me another? Actually, I can probably grab it right up here. But your foot's aligned. If you look at it, your foot is aligned.
it is.
It does look better.
Yeah.
It's just really, really swollen.
Yeah.
So let's get that swelling down. Next time, if this happens again, I mean, it's never gonna. We're gonna hope it doesn't happen again. If you do end up in the ER and we do have a specific dressing on, make sure that they call me and don't let them take it down until they talk to me.
Okay.
I have a specific dressing that I'd like to do because that particular dressing, albeit is uncomfortable for the first couple days, makes the rest of the surgery that much better, and that's the compressive dressing.
Okay.
Now you wouldn't have known that, which is fine, but I expect them to call me when they can. The fact that they didn't call me kind of infuriates me a little bit because I've had this problem several different times.
Yeah.
It's all your MC for you. I went up there 2 years ago because I had a displaced left hip and a bunch of slip discs in my back, and my neck was all messed up. And
This door, they're here.
Who's that?
The people.
No.
The inspection.
Go ahead, I'm sorry.
like they gave me an X-ray, told me I'm perfectly fine, just
Sent
take
you on
muscle
your way.
relaxant. Yeah, and I go to a chiropractor. First words out of his mouth after a basic examination is like, "How are you even walking? Your left leg is almost out of the socket." I'm like, that's nice. I'm glad I didn't fucking take their advice.
Yeah, like the hospital, I don't know. The guy I just talked to, he'll be able to handle it.
Yeah.
I think makes me very, very upset. You know, it gives us a bad name because, well, the ER docs, a lot of them don't care. They don't see you ever again.
Yeah. Like I know there's one guy up there that has like kind of like a crazy goatee on him. Like he's pretty cool. Yeah, like he took a look at me Saturday night because I've been having problems with like I wasn't sure if it was like a muscle pull or something, but I guess it was an inflamed joint, like kind of in my pelvis. It's been hurting pretty good, but I went Saturday night. He like looked at me for like 30 seconds. He's like, "No, that's not a nerve in your leg."
Yeah, they some of the docs up there are pretty good, you know.
Yeah, there are good ones for sure.
Some of them just are.
Just
Let's get you in and out as fast as possible, so we can keep moving, right?
Yeah.
No.
Either that or
That was probably the reason why I never got a phone call that you were in the hospital.
Yeah.
Here's the thing, and here's why I get mad. If
They even tried to tell me Saturday my insurance didn't exist anymore, and I have the same as her. So now they're waiting for the bill to show up in the mail so I can just go up there and throw it in their face and like eat it.
I don't understand. You
Yeah.
know, they have a bad reputation right now, and you would think they'd want to get
Have
better.
for years now. And it's usually because of the nurses they hire or something, rather than the doctors
They're
too.
just idiots. Some of the nurses are so.
Oh, I know.
I mean, who took your dressing down, the doctor or the nurse?
It was the actual doctor.
He did.
Yeah.
Or she did.
She did, yeah.
And what did she say? Why was she taking it down?
To make
I'll
sure there
make sure it
wasn't.
wasn't an infection be causing her nausea.
And you told her you just had surgery?
Yeah.
Like Thursday.
And you told her you were on antibiotics?
Yeah.
And she still took the dressing down?
Uh-huh.
And then what'd she say when she took the dressing down?
Well, it looks fine. Well, we're just gonna put like half the bandaging back on so it's lighter for you.
Doesn't really feel lighter though.
Well, because you're swollen now.
Yeah. But it shouldn't.
See, look at the way this splint is sitting. See how it's kind of up this way?
Yeah.
And they let your foot sit that way, and that really ruined my dressing.
Yeah.
But don't get defeated. I'm gonna make it better. All right.
Nah.
If I couldn't make it better, then we got a problem.
Might need to go back to school.
Yeah. All right. Let's make your. I'm just gonna have you sit just like that. Okay.
No, that's fine. It just.
And then hold it just like that if you can.
Uh,
I'm gonna kind of come up like that. Okay. And I'm gonna do.
it's hard to hold it there.
Yeah.
Just like what I'm going to do is lock your ankle in so you can hold it, so then you don't have to hold it anymore.
Yeah.
Alright. Hey Trish. She
Like I just didn't get why the bandaging on the other ankle. Like I know she kept trying to explain like because of circulation, but I just didn't get that.
So what it does, it helps moves the fluid out of the fluid and the blood out of her veins,
Okay.
pushes a form of clot. Are you taking the
Oh yeah, I've been giving her the shot.
Can you help me and hold her leg up a little bit here?
Wait, so are you gonna put that back on me?
Yeah.
Yeah.
For the first 3 weeks, we talked about it.
No.
You hate it, I know, but it's gonna really.
I didn't
help
think
you.
it was gonna be so uncomfortable though.
Well, it shouldn't be if you weren't so swollen.
That's not your phone.
I know, but I'm so used to answering a different tone anymore.
Do you mind if I can, this is the guy that's helping me out about
Yeah, go for it. It's fine.
the.
Holy.
No wait,
Oh,
Trish, your back doesn't kill him. Alright,
How
so
high can this go?
pretty high. Let's bend your knee so that way it doesn't. There you go. Because you're gonna get muscle spasms if you don't bend your knee. All right.
I do a lot. I've been twitching a lot.
Yeah, so that's because you're not bending your knee. So if we can keep your knee bent, you'll prevent muscle spasms. Okay.
Still doesn't feel like it's all the way over though.
It's all right. It doesn't have to be.
Okay.
It doesn't have to be. Doesn't have to be the whole way over. We just don't want it to sit the whole way over this way. Can you wiggle your toes? Can you feel me touching your toes?
Yeah.
Good. Alright, bend your knee a little bit. There you go. Big thing is to get the swelling out.
Yeah.
Once we get the swelling out, you're gonna feel a lot better, okay?
Hopefully.
Then I'll need a 6" in a second as well.
Okay.
Grab this real quick before you put it down so you don't have to look up 2 times. Alright, go ahead and put it down. Okay.
The only thing that bothers me is the fact that I can't feel my like ankle touching like that one part.
Over here.
Yeah.
Come on, put a little
That's why I'm like,
stuffing or something in there.
Yeah, you can, but it's alright. It doesn't have to touch there.
oh no,
I
it
mean-
just bothers me.
Thanks.
Mm-hmm.
Probably actually good to have a little gap there in case you do bump your heel off of something.
Yeah, and you're not going to be putting any weight down anyways, right?
Yeah.
What bothers me is that I never knew you were in the hospital.
I did call though to let you guys know that I was going.
Yeah.
Yeah. Yeah, I remember that. You left that
Mhm.
message.
Like I had to hurry up. He's like, I'm taking you to the hospital. You can't even keep anything down. I'm like,
Okay, I'll see you in a week, alright?